Imagine walking into a restaurant, ordering a burger, fries, and a soda, and then 2 weeks later, you get a bill for $8,000. And the kicker? There's a mysterious $1,200 charge labeled bun holding fee. Welcome to American healthcare, where prices are made up and the bills don't make sense. Today, we're diving deep into why healthcare in the US is so expensive. Spoiler alert, it's not because the doctors are driving Lambos, although some of them are. Let's start with one of the biggest money vacuums in the system, administrative costs. In most developed countries, healthcare is simple. You see a doctor, the government picks up the tab. Done. But in the US, you've got private insurance, Medicare, Medicaid, HMOs, PPOs, out-of-network, in-network, pre-authorizations, billing codes, and appeals. It's like every hospital is also running a mid-sized accounting firm. Administrative overhead eats up 25 to 30% of every healthcare dollar in America, just pushing paper, or PDFs now, I guess. The US has 5 administrative healthcare workers for every doctor. That's billing specialists, claims processors, coders, entire departments dedicated to arguing over money. Meanwhile, Canada spends just 12% on administration. A 2021 study estimated that administrative bloat costs Americans an extra $1 trillion every year. It's the equivalent of everyone in the country paying a second secret tax, just to fuel bureaucracy. Now, if you thought that was bad, consider prescription drugs, because that's where things really start to feel surreal. Americans pay 2 to 3 times more for medications than people in other countries. Why? Because in the US, pharmaceutical companies can literally charge whatever they want.
How much for this life-saving drug? I don't know. What's your bank account look like?
In countries like Canada, the government negotiates drug prices. Here, Medicare is legally barred from negotiating prices. Thanks, lobbyists. Fun fact, insulin, invented 100 years ago, costs about $6 to make. In the US, it sells for hundreds of dollars a vial. Or take the cancer drug Revlimid, costs $763 per pill in the US, $280 in Canada. EpiPens, essential for severe allergic reactions, skyrocketed to $600 a 2-pack at one point, a product that costs about $30 to make. Drug companies justify prices by citing research and development, yet they often spend more on marketing and stock buybacks than actual R&D. And then there's the likes of Martin Shkreli, nicknamed the Pharma Bro. In 2015, his company infamously hiked the price of Daraprim, a life-saving drug for parasitic infections, from $13.50 to $750 per pill overnight. He became the poster child for pharmaceutical greed, and a stark reminder of just how easy it is to exploit America's system for profit. But the story doesn't stop at the pharmacy. Once you set foot inside a hospital, the pricing games get even bigger. US hospitals are expensive because, well, they charge more, way more. An MRI in France, $280. In Japan, $140. But in the US, $1,100 for that selfie of your insides. And don't even get me started on the facility fee, where you pay extra just because a procedure was done inside a hospital. Not because it was better, just because it was there. It's like going to Starbucks, ordering a coffee, and getting charged an extra $50 because you sat down. Hospitals in the US are often massive corporations. Some bring in over $5 billion annually. Many are technically non-profits, but operate like Fortune 500 companies. Some of these hospitals own helicopters, buy real estate, and pay CEOs millions in salary. A single emergency room visit for something like dehydration can cost $5,000, even if the treatment was just IV fluids and a few tests. And what happens when hospitals worry about lawsuits more than patient needs? Well, that's where defensive medicine comes in. In the US, doctors order more tests than necessary. Why? Because lawsuits.
Hey doc, do I really need a full body scan for this paper cut?
Well, probably not. But you might sue me if it turns out later you had something, so let's go ahead and get that scan. Also, it boosts my hospital's revenue.
This is called defensive medicine, and it adds billions to our healthcare costs every year. It's like going to a mechanic who recommends a new engine because your windshield wiper fluid is low. A simple case of back pain might trigger multiple MRIs, a CT scan, nerve conduction studies, and specialist referrals just to cover all bases. Estimated cost, $10,000 plus, even if the actual diagnosis was just a muscle strain. Studies show that 1 in 4 tests ordered in U.S. hospitals are medically unnecessary. And while defensive medicine adds layers of cost, there's an even bigger, slower-moving problem driving expenses up: chronic illness. The U.S. has higher rates of chronic conditions than most other developed countries. Things like obesity, diabetes, heart disease. Treating these conditions is insanely expensive, and our system focuses on treatment over prevention. It's like waiting until your car bursts into flames before taking it to the shop. About 60% of Americans live with a chronic illness. Diabetes alone costs the U.S. $327 billion annually. Preventable diseases drive most of our healthcare spending, yet our system barely invests in preventive care. Less than 3% of all healthcare dollars go to prevention. Compare that to countries that offer regular health screenings, nutrition counseling, and exercise programs, things that keep people healthier and lower long-term costs. And behind all of this, there's another major player pulling the financial strings: private insurance. Private insurance companies collect your premiums, decide what's covered, negotiate with hospitals, and make billions in profit. Because when you think of healthcare, you definitely want a system where some guy in a suit decides if you're allowed to have surgery. They spend millions on executive bonuses and marketing. Meanwhile, you're on the phone arguing why your ER visit was out of network, even though the hospital was in network. United Health Group, one of the largest U.S. insurers, made $22 billion in profit in 2023. CEOs of major insurers routinely earn $15 to $20 million a year. Insurers also engage in prior authorization, requiring patients to get approval before certain tests or treatments. This delays care and often leads to worse outcomes. Yet, they claim it's about controlling costs. If all that wasn't enough, here's the kicker. Most of the time, you don't even know what anything costs until it's way too late. Here's the wildest part. In the US, nobody knows what anything costs until after it's done. Imagine getting your oil changed, and 2 weeks later, they tell you it cost $8,000 because a specialist had to tighten your lug nuts. Surprise? Even hospitals don't know what things cost half the time. It all depends on your insurance, your deductible, and probably the moon phase. A knee replacement might cost $35,000 at one hospital and $120,000 at another for the exact same procedure. A study found that calling hospitals to ask for prices rarely works. Staff don't know or won't tell you. The 2021 Hospital Price Transparency Rule was supposed to fix this, but compliance is low and enforcement is weak. And when you zoom out, the real reason all of this happens becomes painfully clear. Because healthcare here is a business. Every part of the system, hospitals, insurance, pharma, is designed to make money. And the more sick people there are, the more money they make. Curing you? Not as profitable as treating you forever. That's why the U.S. spends nearly 18% of its GDP on healthcare, more than any other country, but doesn't have better health outcomes. Dialysis is a perfect case study. The U.S. has the highest rate of dialysis in the world. Companies like DaVita and Fresenius dominate the market, generating billions annually. Meanwhile, fewer resources are spent on preventive kidney care that might avoid dialysis in the first place. Profit incentives shape the system, often away from patient well-being. The sad part? Most Americans don't realize just how abnormal this is until they get sick in another country and wonder why their hospital bill is less than their hotel stay. But here's the good news. There are solutions. Other countries have figured this out. Transparency, stronger regulations, investing in prevention, these are real, actionable steps. If you want to learn more about how we can fix this, hit subscribe. We'll be breaking that down in the next video. If this video made your blood pressure rise, congratulations, that'll be $500. Just kidding. But seriously, share this video, subscribe, and let me know in the comments. Have you ever gotten a ridiculous medical bill? What's the worst healthcare story you've got? I'll read through them once I finish fighting with my insurance company over this sprained ankle.